So it is now currently about 5 days past surgery, and I'm actually filming a vlog, so subscribe if you want to see like how recovery's gone. I've recorded a lot of it, but I thought I would jump in and kind of talk about the day of surgery, walk you through the day, and kind of explain how it goes. I watched Tess Barkley, I believe that's her channel name. I'll link it down below, the video she did. She just had a breast reduction and talked about it, and I thought it was super interesting. I mean, a breast reduction is something very different than an ACL surgery, but in case you're having ACL surgery or just curious on how the surgery process works, I thought I would walk you through it. Good morning, it is surgery day, and I am feeling pretty nervous. It is currently about 7:40 a.m. My surgery is at 11, so I have to be at the hospital for 9. So we are just getting ready to go. I'm just taking out all of my jewelry because you can't wear jewelry to surgery. I've been feeling pretty nervous for about the last week or two, maybe even longer, but not letting myself feel it, or else I would have just had many emotional breakdowns. I feel like it's something that people would never really realized I was anxious about because I was really trying to repress my feelings. Like, my mom was surprised yesterday when I told her. And this morning my dad sat on my bed and he's like, "It's gonna be fine, you've been through this before." Which was shocking because that's just not normally something I would have a conversation with my dad about. But I am having a ACL reconstruction for the second time, which hopefully the last. So I'm nervous, I'm anxious, and I can't get my ring off. I'm gonna finish taking off my jewelry, get changed, and then I will see you before we head out. Weird way to start the new year. Okay, I'm dressed. I'm wearing my manatee socks for good luck. I'm nervous. Let's go get an ACL replacement. We ended up getting to the hospital about 9 a.m. You go get your band, you check in, they run through some paperwork with you. Then after that, we were brought to the family surgical waiting room. I'm all checked in, ready to go. Now I'm just waiting to get called. I'm nervous. We waited there for about 5 minutes, and then a nurse came and got me, and I was allowed to bring one person with me. So this time I brought my mom. Me and my mom then went over to the day surgery area where we moved into an even smaller waiting room. This waiting room I think only fit about 10 people, and that's why I was only allowed to bring one person with me. When we got there, I was quickly seen by a nurse who gave me 5 different pills. I think it was like an anti-inflammatory, 2 Tylenol, a joint pain, and something else. I don't really know. Just nodded along and took what they told me to take. They also then go through a list of questions asking how you're feeling that day, if you have any other symptoms. They also ask you like 5 or 6 times, not necessarily in this, but throughout the day, what operation you're having done, who's performing it, and what leg it is happening on, which is good. I'd like to make sure that they operate on my left knee and not my right. Past that, I was sent back to the waiting room where we hung out for maybe 15 more minutes, and then after that we were brought over to a different waiting area. This one is one that actually had like a hospital bed. I had my mom take my photo here. I filmed a little OOTD. OOTD. Then at this point we waited in the bed area for probably ended up being about an hour. We were waiting for my surgeon to come see me to answer any questions, check in, and once again ask what leg I'm being operated on. My surgery got pushed a little bit. I was definitely supposed to go in, I think at 11. I think my surgeon came by at about 11:20. And honestly, he is very brief and very quick. And he was like, "Hey, what leg are we doing done? Good to see you, Catherine." Shook my hand. They call me Catherine because that's my legal name, and drew an arrow on the proper leg, which is my left. It's kind of funny that they mark it, but also I'd rather make sure that they double check 8 million times than operate on the incorrect leg. I had a couple questions about the actual donor. This ACL surgery was different. It was being given by a donor. I've had ACL surgery in the past, so this one was given by a dead person, so I'm a little bit of zombie now, which is something I never even really thought about, the fact that people would donate tendons, but very thankful for those who choose to. And I don't know anything about the person who did. I was curious if like age played a difference, like a 85-year-old versus like a 20-year-old. And he was like, realistically, they wouldn't give us someone who is older. It doesn't quite as much make sense. But if I wanted to know the specific facts, he could have pulled them. He didn't, I don't think, but that was okay. I was also curious if like the gender played a role. He said it didn't, so I trusted my surgeon. After that, he disappeared, and we then had the anesthesiologist come over, and he just asked basic questions. If I've had problems with anesthesia before, any health-related issues happening right now, and he was like, nope. And then he was like, okay, see you soon, and off he went. And I had about like 5-10 more minutes with my mom, and at this point I wasn't feeling too anxious, which I was really happy about, because going into the surgery I was like leading up quite a mess. As you've seen in this video, I was definitely overwhelmed and stressed out, and didn't quite know how to admit that to myself, let alone other people. I just was like really trying not to think about it. But I think because the whole hospital day so far had been so long, that I just kind of had the chance to mentally prepare, and everyone I interacted with, nurses and hospital staff, were so kind and accommodating that just made it feel like that much less overwhelming. Then I had a male nurse come and grab me, and we walked over to the OR, which he was so kind and just like made me feel so at peace, which I was so thankful about. He was asking questions about like how I injured myself, when I had the surgery in the past, if my same surgeon had done it before. He was just like chatty and small talk, but like kept me calm, which was great. And then we walked into the OR, and the OR, if you've never been in one before, I'd say it's probably pretty similar to what you see on like Grey's Anatomy and other hospital shows. It is just like very white and sterile. It is very bright and very cold. There's 3 different nurses in there, as well as the nurse who walked me in and the anesthesiologist. I believe one of them was to help the anesthesiologist, one was to help the surgeon, and one was just prepping the room. Not quite certain. I was introduced to everyone, but honestly was kind of like tunnel vision, blacked out at that moment. Don't really know who anyone was. You end up laying onto the bed, and they started by with this arm attaching a blood pressure cuff and then a oxygen reader. You're not allowed to wear nail polish because they can tell your oxygen through your fingernails or something of that sort. But you get hooked up to that. You get to hear your heartbeat, which is kind of stressful and overwhelming. You could hear mine like literally speeding up due to anxiety. So I think they ended up muting that, but your girl was stressed. And after they finish with one arm, they strap that one to the table. Then they take your other arm and insert your IV. Your IV is just like a really tiny little needle, but that was definitely uncomfortable. Even when he inserted it into me, I was like, oh God, that's not comfy. And they were like, yeah, this is the worst part of the surgery. And I was like, haha, good thinking. And then random fluids are flowing into you. I don't really know what's happening. And then they end up strapping this arm down and taping a million things onto the IV. Yeah. The anesthesiologist was funny. He made me giggle. He just like flipped the switch and was like, have a good sleep. I just like laughed and was like, haha, thanks. The weirdest feeling ever, because I could taste the anesthetic at the back of my throat, which I don't even know how to describe. It just felt like kind of like cold, like a brain freeze, but like trickling down in the way that like mustard trickles. That's like probably the grossest and weirdest description of it, but it was just the oddest feeling. And I remember I was about to say to them, being like, oh God, I can taste it, that's weird, and I was out, like blinked and I was gone. Yeah, weird. Last time I had a oxygen mask, I believe, and they asked me to count down from 10, and I made it to like 8. This time I just was asleep, which was kind of okay. It's also nice because when you lay on the bed, they put like this really nice warm blanket on you. You get like comfortable. They, I think, weighted down my good leg. It was great. I felt relaxed, I felt calm, and I didn't cry falling asleep, which was a bonus because last time I had ACL surgery, I cried falling asleep. So after surgery, I woke up in the recovery room. My surgery was about 2 hours and it started at about 11:30. I think I woke up a little bit closer to 2. Woke up and everything was just a blur. It's like really, really hard to keep your eyes open with the anesthetic, and you like don't even really realize what was happening. I remember when I woke up, they like continuously ask you what your pain level's at, and they've attached now to your IV pain medication. I think I said I was about a 6, 10 being the worst, 1 being the least. So 6 was pretty substantial, and at one point it kind of raised up to a 7, and then they were able to get it down to a 3. The problem with painkillers is they do not agree with my system. I felt very sick and nauseous, and that made it difficult because I couldn't keep my eyes open. They ended up having to give me oxygen too to really help push the anesthetic out. You have to focus on taking deep breaths, but I was just so like exhausted and sick that it wasn't working. So they were pumping me with oxygen, and I also get a really dry nose, and it's been bleeding a lot recently, so the oxygen was like poking in spots that like made it felt like I was gonna have a nosebleed / made my face really itchy. So I'd like continuously pull it out to like scratch my nose and put it back, and the nurse was like, no, leave this. It was a bit of a mess. I just like kind of blocked this out apparently. But while I was first in the recovery room coming out of surgery, I couldn't really keep my eyes open. They ended up taking some x-rays, which is good. I think they checked them and they were going smooth, so that's awesome. But I just remember them like moving me around, arranging my leg, and the girl had no idea what was happening. I couldn't keep my eyes open, couldn't tell you how many nurses were there, how many technicians, had no idea what they looked like, but I hope they got what they wanted. Eventually fine and awake enough and out of enough pain that I believe they just rolled me over to recovery. I don't really remember. This part is like really foggy and really blurry. And when I got moved over to day surgery recovery or something like that, it's where my family was able to come see me. So my parents came over and I could like hear them before I could see them. I was like really having problems seeing. It was really blurry. But after about 2 hours of like dealing with nausea and fighting painkillers versus like getting ready to go and being like well enough to be sent home, got wheeled out to the car and sent home. I remember my mom took a couple photos of me because I wanted to see what I looked like, / I posted some things on Instagram, and I remember it took like absolutely all of my energy to take these photos, and they are horrific. But that's kind of how the surgery went. We didn't end up leaving and going home until about 4:30, and the issue was when I was like up and moving, like transferred to the wheelchair to go to the car, I felt so sick and I thought I was going to vomit because just the movement with the painkillers did not agree with my system. Thankfully, as soon as I got outside and got some fresh air, I was like fully clear, feeling so much better. And when I got home, I kind of had the same issues. I felt really sick going from the car up the stairs to my bed. But once I was in bed and had like a cold cloth on me, I was fine. I'm continuing the vlog on my phone because I honestly can't get up to get my camera because I'm on crutches.
It's 7:37 p.m.
It's 7:30.
Hope your week is off to a great start.
It's kind of ironic. It's not a great start. But I am home and I am feeling really good, shockingly. I am in not that much pain in comparison to what I thought. I've just been nauseous, but when I'm sitting still, I'm fine. I've been wearing frickin', what are those called? Face cloths on my head to control nauseousness. I've gotten so many loving messages from family and friends, which I'm so thankful about. And I honestly don't think this will be that difficult of a recovery. I mean, obviously recovering from surgery isn't easy, but in comparison to what I expected, I think this will be really easy. Since then, I have not been taking any painkillers other than over-the-counter Tylenol, which I haven't taken for a couple days now, which is awesome. So that's kind of how day surgery works, or at least my experience with it. The care I had from all the nurses at the hospital was great. They were all so caring and fitting to my needs and just so patient with me because definitely I was a bit of an emotional mess and physically very unwell. So very thankful for everyone for answering my million questions and dealing with sick Katie, and thankful for my parents who have been so caring and helpful. Yeah. Anyway, that's kind of a day of surgery story. I hope you've enjoyed hearing about it. I hope you choose to subscribe, and if you want to keep seeing kind of the surgery recovery process / my life, here I am. Thumbs up, subscribe. This year is going to be a big one. If you thought 2019 was crazy for me, girl, I got bigger plans for 2020. We'll see if I can pull through. Anyway, thanks so much for watching. I will see you very soon.